You.
The Late Lunch with Moorehall Lodge Retirement Village RD for secure, independent community living. moorhallliving.ie.
Well, you're listening to it there on the ad for Moorehall Lodge, and the man himself is with me today, Michael McCoy. Can you believe this, that Moorehall Lodge on the south side of Drogheda is celebrating its third birthday this year, and they're looking for people to join their team because, you know, it's a unique model of care that they offer there to residents. Michael, it's great to see you again.
Good afternoon, Jerry.
Thank you for joining me.
Thank you.
3 years. It's flown, hasn't it?
3 years, yeah, it's fast. 3 years. On the 31st of July, we took our first resident into Moorehall Lodge in Drogheda. So it's 3 years. Been busy 3 years, but it's 3 years now.
You're full up.
We are, yeah. We built it in different stages. It's on the household model, as you know, and we built 4 households initially, and we just opened 2 households early in the year this year. So we can cater for 108 people in total in Drogheda.
What do you mean by households? You better tell them what that's all about, that model.
Household model is really trying to create a home from home, a non-institutional model, because we believe firmly, and I think most people now believe, that why should anybody be cared for in an institutional model? It's not necessary to wear uniforms, it's not necessary to have institutional symbols. So really and truly we're trying to create all the things that people would experience in their own home. Notwithstanding, who doesn't want to move out from their own home? Everybody wants to remain living in their own home, and we all accept that. That's an argument that's long since gone. But for those people who do need care in residential care, it's about 30,000 people at the moment that's in residential care. We're trying to create that transition from the domestic home into a care facility or care home. So we're trying to create the symbols that people would have in their own home. So in Drogheda, Moorehall Lodge in Drogheda, we've created a street, as we mentioned here before in this programme, a Cope Street. So we have all the shop fronts, we have all the reminiscence that you would see. And then we have a domestic front door, we have a strong colour, we have all the symbols that you would have in your own front door in anybody's own house. And then we try to create home inside that. So we don't have institutional symbols, we don't have uniforms, we don't have drug trolleys, even though people need medication, that's without question. But we're just trying to create the social model of care as opposed to the medical model, even though it's necessary to have both pieces of the model. But so the household model is really trying to create a home from home as far as possible, notwithstanding that people are living communally in more than 10 people. 2 of our dementia households of 10 people, and some of the other households about 20 people. So I know it's communal living, but people still have their own privacy and their dignity with their own bedrooms and the living spaces. So it's trying to create home, and we do encourage families at all times to be part of that, and which to do, because we never can replace families. We just try to support families, for that person at that stage of their life, really. So the household model, it's an important model. It's the way forward.
I've heard the feedback from families of residents there, and they absolutely love it. You mentioned dementia, and dementia cases are growing all of the time, and they're searching now at a scientific level to try and get something that will, unlock this or stop it or reverse it or whatever. But you have to deal with the practicalities of it. Is it a specialist type of care with dementia?
It's a specialist type of care. There's maybe a little bit of confusion over cognitive impairment or dementia or Alzheimer's being one of the dementias. But there is a vast majority of people who are in residential care would suffer from a cognitive impairment. But if somebody has an Alzheimer's or a real dementia, there is a specific way of catering for these people. And we have developed, and there was a programme on TV3 actually, Jerry, in December last, on the 3rd of December, Home from Home, and it described some lovely journeys for people through the butterfly process. And particularly it was an RD in Moorehall Lodge in RD, not in Moorehall Lodge in Drogheda, but the butterfly process. It's really just getting to the person and trying to create and change the moment for the person, and it's really, really, really effective. But it's really all to do with the staff and their attitudes and proper training for staff and families as well.
Now that brings us on to your reason data that you're with us today, because you are looking for people, Michael.
Yeah, we have as we speak 250 people employed in the Moorehall Living Group. We have a number of services, as you know. We have Moorehall Lodge in Drogheda, we have Moorehall Lodge in RD and the Retirement Village, and we also have a disability service in RD as well. And we have the home care. So we employ about 250 people, which is a great employer in this area. It's a great employer. But we're always looking for the right people. You know, it's important that people who care actually care for themselves, number one, and then are able to care for people who need care. So we have a number of vacancies at the moment. We have some vacancies for nurses, but as we mentioned earlier on, I don't think we're the only people or the only group out there that's looking for nurses. We know that the HSE have recently just put out a launch and gone to the UK. So we have the same needs, but in a nursing home, it's different in an acute setting. And with the household model, we believe it's a work environment that people will like. So we have a number of vacancies. We have 25 vacancies in total, to do with care staff or ancillary support staff or healthcare assistants, whatever title, and qualified nurses as well. So the nurses, obviously, you need your nursing qualification. The healthcare assistants, you must have a VTAC level 5, a major award, and I can go into more detail about that if you want to. But it's essential that they have a VTAC level 5. And the colleges that are doing the VTAC level 5 are DIFI, the Drogheda Institute for Further Education, and O'Feet College in Dundalk. There's also a large number of private providers who provide this course as well. So the 8 modules that are covered are care skills, care support, care provision and practice, care of the older person, and then work experience. And there's a few other modules that are optional as well. But that's the major award that can be done over 1 year, or it can be done as a part-time basis.
So you could register for that this coming September and do it full-time for a year and be in a position to take up a position at the end of the academic year when you pass all your exams.
Absolutely. And we would encourage people that are even in the middle of the course or have started the course to apply to us. They can go onto our website, www.moorehalliving.ie, go to our recruitment section, download an application form, and just send it in or drop it into either Moorehall Lodge in Ardee or Moorehall Lodge in Drogheda, and we will take it from there. Now we do. I try to, in all cases, try to interview and meet the people myself because I do believe very strongly. We do believe strongly in our philosophy that it's the people that matter. It's the people that make the difference. Now we do have a nice facility in Drogheda and Ardee, and that goes without question, really. But the importance is who the people are, what they stand for. And a funny question that I always ask at an interview, and sometimes they get a laugh, and I says, what's your heart like? What type of a heart do you have? It's not a typical question that you would be asked at an interview, but it's a good question because what you're trying to find out, who are these people? What is the person? Notwithstanding the qualification that they present with, but who are they? What are they like?
I've never heard anybody ahead of interviews giving you a good tip like that, but there is coming from the man himself, so you can be prepared for that. Coming back to the nursing, what about somebody who's maybe returned back home or somebody who's retired from mainstream nursing? Are you interested in talking to people?
Absolutely. A nurse who is qualified and has the that's registered with NMBI, and we do know that there are difficulties becoming registered with the NMBI, but if they're coming back from the UK or coming back from anywhere and they're not registered with the NMBI, it's a slow process, but stick with it. But those who are registered with the old Nursing Board or the Nursing and Midwifery Board of Ireland, we would like to talk to them, and we will support them through a transition of returning to work. We will help them, do some work experience, even work in a non-nursing position for a period of time. We've done this, and we're doing it as we speak with a person who wants to get back into nursing. 2 people actually. So we would have brought them back in a support mentoring process, and that has worked really, really well to build up their skills, to build up their confidence. So those who are returning to nursing maybe have achieved in rearing their families or whatever, whether it's a man or a woman, where we would welcome to hear from them.
What about home carers? Somebody who may have been caring for a time for somebody at home. Maybe they're not doing it now. Maybe they've changed. They want to come back to this, or maybe sadly somebody has gone or passed on. What about those people? Do they need that qualification? They've done it for a long time. They'll need to get the VTAC as well, will they? Absolutely.
Well, if they have experience, it's experience. You can't question experience. Well, you can question experience, but you can't. It's invaluable to have experience. But for those who have the right heart, and if those who have some experience, whether it's home care or whether it's doing private caring for somebody, you can ring us up and we'll give you advice on the process to do with the VTAC course. But it's essential that if you haven't even started the VTAC course, you have to be committed to get the course either started or be in the middle of the course or completed. And you would be amazed of the amount of people that have the VTAC Level 5 course done.
What do you get from this career? What does it bring back to you as somebody who cares for somebody else?
Well, I'm a nurse by profession. I trained not too far away from here in St Mary's in Drumcar a few years ago now. I don't really want to say, but a few years ago.
We leave the years out of it, Michael.
Leave the years out. So I trained there as a nurse, as a young lad at 17 years of age. I then did my mental health nursing in St John of God's in Stillorgan. And then, when I was a mature person, I did my general training in James Connolly and Blanchardstown. I coincidentally then worked overseas with Concern. Caring was always part of my vocabulary, and that was probably my initial motivation of setting up our facility. Never thought it was going to be, a facility that would employ 250 people when I was working out my figures all 20 years ago. I never envisaged that we would be in this position. But caring is the most important ingredient, and old-fashioned people say, caring or nursing is a vocation. And maybe I'm old-fashioned, but in some respects it is. Because if you don't, as I said earlier on, have the heart of, then you're not going to vocate the time. And unfortunately, some people do go into caring that just don't have that, whatever word you want to call it. If it's vocation, whatever it is, it's an old-fashioned word. But I don't think it's an incorrect word.
So it's not for some people. If it's not for you, you're better off staying away from it.
Absolutely. And I'll tell you, if it's not for you, we'll tell you it's not for you. Because it's important that we support the people that it is for, that they have the right heart and that they're interested in what they're doing. So we will support those people. But we'll also say to people, listen, this is not for you. This is not. That might be a little bit difficult to hear, but it's important for us that we can trust people. One of our mottos over the years is trust us to care. So the families are asking us to trust them trust us to care for the person, because it's not an easy transition to come to care from per person.
I like the honesty. What about flexibility for someone that mightn't be able to give you 40 hours a week? Are those type of people catered for?
Absolutely. Particularly in nursing, we will be very flexible. It may not always be exactly school hours and things like that, because obviously somebody has to work those other hours. But we would welcome flexibility. We're quite flexible. Because as I said to you earlier on, Jerry, we're interested in who the person is. Initially, being a nurse or a carer, but we are flexible and we would create flexibility. But at the end of the day, we have to make sure that the people who are caring for are cared for properly. So even though their school hours or wherever other hours are required, the other hours have to also be covered. But flexibility is an extremely important part.
Look at the demographics of the Irish population. You're well aware of it. What's coming down the tracks? You're full here in your new facility in Drogheda. This model that you have and this way of being cared for is the future for more and more of us.
I believe so. And we do believe at Moorehall Living that the household model is the way forward. We went to the States on a number of occasions. We looked at the models, and we do believe it's not a science. It's real life, because more people will need residential care. And as I said earlier on, there's no question that 85% or more greater percentage than that of people want to live at home. That's not a question. But we have an ageing population, so we have to be really real and see how we're going to cater for the population, because it's quite difficult to get a nursing home bed as we speak. Quite difficult.
Oh, very difficult. What about volunteering opportunities within Moorehall Lodge? And can that lead on ultimately to perhaps a career down the road?
Absolutely. Volunteerism is a crucial part of life. There was an award here. You had a competition here for a volunteer, and Eileen, who volunteers in RD, won the competition as the volunteer of the month, I think, or the year. So volunteering is a crucial importance. The volunteer, you can have a number of types of volunteers. You can have a person who basically has some spare time at the stage of their life where they want to give time and give something back. But you also have the volunteer that's at a stage of their life where they're not sure what areas they would like to develop. And by all means, when people volunteer with us, they may see and they may understand and may believe that, listen, this is something I would like to do as a career. And then we would know the person as well to be able to see, is this a career that we could encourage them to do, or is this a career that we could support them with? And then the qualifications and the necessary education that would go along with that. So volunteerism is a huge part.
It's a good step on the ladder, isn't it?
Absolutely.
It's a good way of dipping your toe in the water, seeing what this is all about.
Absolutely.
Before we finish, will you just give your details again to the website, please?
Yeah, it's www.moorehall.ie. Go into the recruitment section, download an application form. Please don't send in CVs in isolation. We get CVs every day of the week, more than one, but it's essential that you actually download the application form, fill in the application form completely. Please fill it in completely. And the last thing I will say, Jerry, is just if you are called for interview, just do a little bit of research on our philosophy and what we're about. And as I said earlier on, just question your heart, because there will be questions that will be asked. But I think it's important that people would do a little bit of research into the philosophy of care that Moorehall Living has, that you'll be able to have it. We could have an open, informed discussion then at the interview.
Michael McCoy has a big heart. We all know that. Congratulations on 3 years on the south side of Drogheda and all your work across the board, RD as well, and everything else you do. We wish you well with this. Moorhallliving.ie is the website again. Yeah. Go in, download the form, fill it out and get it into Michael. And you heard already, if you start the education thing, if you have experience, if you're coming back in nursing, if you're retired, he wants to hear from you. Continued success, Michael McCoy. Thank you very much for joining me on the show.
Thanks for having me.
That's our lot on Late Lunch for this afternoon, folks. Have a nice Tuesday evening. We'll see you Wednesday, 1:30.
The Late Lunch with Moorehall Lodge Retirement Village RD for secure, independent community living. Moorhallliving.ie